Welcome to our UCLA Alumni Association Town Hall. I am your Alumni Association President, D'Artagnan Scorza, proud to be joining you this fine evening as we talk about issues that matter to our alumni community, as well as dig into the topics of today. I want to thank you again for joining us. You know, we began this series of town halls on Zoom and made them open to all UCLA alums with the goal of providing regular campus updates so we can engage you in conversation with UCLA leadership, faculty, staff, students, and students with our alumni community. You know, when we started this conversation, we began by talking about COVID and how UCLA had been responding. We talked about what the state of the campus has been and how we're preparing for what we hope will be our return. We've also talked about the way in which our state legislators have been able to help UCLA weather the storm. We've had a chance to talk to the Chancellor. And tonight, and we even had a chance to talk to Martin Jarman last month, who was, by the way, a showstopper. We want to thank Martin for joining us last month. But tonight we have a very special guest, and I'm pleased to welcome with us Johnese Spisso, who is the president of UCLA Health and the CEO of the UCLA Health System, as well as Associate Vice Chancellor of UCLA Health Sciences. I want to thank Johnese for joining us tonight because she has really, in many ways, helped to lead us through this crisis. She oversees UCLA's 4 hospitals, as well as our faculty practice group and more than 170 clinics. Before coming to UCLA, Johnese spent 22 years at the University of Washington Medicine in Seattle, Washington, where she was promoted from Chief Nursing Officer to Chief Operating Officer to Chief Health System Officer, and eventually Vice President of Medical Affairs for the University of Washington. She served in the latter role from 2007 to 2016 and was responsible for 2 academic medical centers, 2 community hospitals, the network of community clinics, and the Airlift Northwest flight program. I want to thank Johnese for joining us, but before we get into our conversation tonight, I'm going to play a very brief video for you so that you get to see and hear a little bit more about Johnese and her background.
We have cures for so many things, and yet with all of these changes, it's that fragile human thread of life that's still important. I know how important patient-centered care is to you and how much you've done at UCLA that many of us have benefited from. Can you talk a little bit more about that and how things have changed, but some things never do?
That's such an important point. And, you know, regardless of the care setting and in all of the improvements that we've made in healthcare, it really does come to that experience that the patient and family have with their team. They expect us to be knowledgeable. They expect us to be providing the best medicine, but it's really how we make them feel through that whole experience. Are we delivering that care with kindness and compassion? Are we culturally sensitive to their needs? Are we listening to them and including them in their care plan? And are we giving them hope, right? We see so many patients where they are facing, life-changing issues for them and for their family. And how do we, through this leading edge care, through this sense of research and discovery, how do we inspire them on that journey through their health care? I think that is most important.
All right. So I want to again thank Johnese for joining us tonight. Welcome to our UCLA Alumni Town Hall.
Thank you so much for having me, and go Bruins. I love our Bruin community, and thank you for all the support to us throughout this pandemic.
Fantastic. We're so happy to have you. So, folks, if you're just joining us, we have welcomed Johnese Spisso here, and we are also going to welcome your questions. If you'd like to send a message to us, please do so by sending a note. If you want to ask her a question, you can email Julie Sina at jsina, which is JSINA, at support.ucla.edu. And we'll try and do our best to take your question tonight. So, and by the way, don't forget, as we do with every town hall, we have a special guest who will be joining us. And so don't forget to stand by this evening as we prepare to welcome our special guest. So Johnese, I'm sure our alumni community has been excited to have you here. And I know the UCLA Health System has done a phenomenal job taking care of patients during the pandemic, but it's been almost a year, right, since we've sort of first learned of this and have been going through this. So tell us, what has this past year been like for you?
Well, thank you. Well, what a year it has been. It's been a year that at times was very chaotic for us, but also it's been a year where I feel there's been a lot of silver linings and a lot of things that we've learned. And in so many ways, we emerged so much stronger as a health system, really prepared to serve our community. Like you mentioned, it was really just about a year ago at this time. We at UCLA Health, we operate a large international program. So actually beginning even in December and January, we were hearing information from our international colleagues in China about the emerging infectious disease that they were seeing. We were staying in touch and we were beginning to put together our own framework of what potentially could happen. We also were serving, beginning in January, UCLA Health served as a resource to the CDC, the team that was based at LAX airport, and began screening all international flights. And so anyone who had the symptoms, the flu-like symptoms that appeared to be this virus, were referred to us. So we were able to really learn and start putting that infrastructure together before we even emerged seeing some cases of the virus here in Los Angeles County.
Fantastic. Thank you so much for sharing that. And I guess, obviously a lot of us are experiencing this pandemic, right? And so what has your experience been like watching it unfold?
Yeah, I think, one of the most challenging things in this pandemic is it unfolded on top of a very busy healthcare system in Los Angeles, throughout the country, and here at UCLA Health. As many of you know, in our health system, which is 4 large hospitals, over 200 clinics throughout Los Angeles and Southern California, we operate pretty much every day at 100% capacity. And then we come and layer a pandemic on top of that, right? So early on, initially, our planning had to really do around what I call the 3 S's. The one was staffing. Do we have staff that are available, and are the staff trained for this emerging infectious disease? The second was supplies, and those supplies in this case, when we had an infectious disease that was transmissible, we needed to make sure we had the PPE, or personal protective equipment, and have that available. Now, as hospitals, we all have a routine supply of that, but nothing on hand that was potentially what we needed. So that was really a lot of work done very fast on PPE. Wow. And then the third was surge space. And so how do we take a hospital system that is already full, and how do we create surge space so that we can care for patients who are coming in with COVID, but also support all the other types of critically ill and injured patients that we see? So very rapidly, last year at this time, we were working on securing those 3 S's.
Wow, thank you so much for sharing that framework. I can only imagine, especially, I know when this all began, a number of us were scrambling to get PPE. So I can only imagine, as you're trying to serve and take care of patients, deal with issues related to ventilators and access to them, right? That there were just a number of rapid decisions that needed to be made. And so thank you so much for ensuring that our healthcare system was able to respond. So, some of the questions that are coming in tonight really center on issues related to some of the frontline workers. So given your history and your background as a nurse, right? I'm sure you know that nurses they're heroes right now. I just want to, first of all, if you're a nurse, or you're a doctor, or you're a healthcare worker, you're an essential worker, if you're working at a grocery store, if you're helping to keep our economy going by taking care of families and serving them in the midst of this pandemic, I just want to applaud you and lift you up, right? I want to thank you for your hard work, because you're caring for our families, even for those of you who are in the labs, who are doing those tests. Just know that on behalf of the Alumni Association, we are grateful for you and what you continue to do for all of us. But I also know, Johnese, as some of the questions that are coming into our town hall are suggesting, that there have been a number of challenges that our frontline and essential workers have been dealing with. One of those has been related to sort of mental health and burnout. So can you talk to us a bit tonight about how you're addressing the mental health and or burnout issue of frontline healthcare workers?
That's so important, and thank you for asking that, and thank you for recognizing the great work that has been done by essential workers. They really are the true heroes, and the silver lining that came through for the community. You know, throughout this pandemic, issues have come and stresses have come in waves. So early on, the first phase of it, you know, healthcare workers were also concerned about how they kept themselves safe or kept their family safe, right? There was a lot of confusion about how is the virus transmitted? Are we safe? Are we safe to even go at home after we work? So we had to do a lot of education, a lot of support. We even early on provided hotel rooms and things for staff to stay, particularly those working in our COVID-19 units, if they didn't want to go home and maybe expose their family. We got through all that phase on education, and I would say as well, we really started improving wellness activities for staff. So we had Wellness Wednesdays every week. We had lots of other resources. And I will say too, a special thanks to the LA community, a special thanks to our Bruin community. The types of gifts and resources that came in to support our staff were incredible. And it allowed us to do things. We served in the first wave of the pandemic, we had 35,000 meals donated for our staff. We were able to deliver those to the units. I mean, things that were amazing. We had some of the spas in Los Angeles donate supplies that they couldn't use. We had our sports teams, the Dodgers and the Lakers, really give us jerseys. They emptied out their merchandise stores so we could give those out to staff. It was little things like that that just lifted people's spirits. The first wave of the pandemic came through, and really before the holidays, things were settling down. The patient load was manageable. And then boom, we had a huge surge in LA. I really saw the fatigue in healthcare workers then. It was, you know, we've got to do this again. We're back to locking everything down, and we were surging with patients. So that phase was a lot harder. And honestly, what people wanted during that phase was just rest. So we really looked at how can we get additional staff in. I will say we had a lot of our retired nurses and physicians who came back to help us. That allowed us to get vaccine stations set up and to start giving people a respite.
Oh, that's a great strategy. You know, it just reminds me of sort of the work of reservists. I mean, I didn't consider that you were able to tap into that pool. So thank you so much for sharing that. So, you know, I think again, you know, as we think about just the ways you've been able to respond in the midst of this pandemic, we also recognize that the pandemic has exposed some of the disparities that exist in many of our systems, right? And I know that our hospital and healthcare system was not sort of alone in this, right? As is our educational institutions. So can you talk about how sort of the pandemic has affected the way in which you all operate? Has it, you know, have you looked at the ways in which it's exposed to maybe some of the inefficiencies in healthcare delivery? Has it changed the way you think about healthcare delivery for the future? I mean, many of us are doing telemedicine now, right? I remember years ago when I was a UC Regent, that was just a conversation. So can you talk about that? You know, what are you doing now to respond to those inefficiencies and deliver healthcare for the 21st century?
Yes, you know, and I think it exposed a lot of things that also gave us the opportunity to improve. So let's start even with public health. Public health has been underfunded for years. We know that, right? And so public health in the time of a pandemic is one of our most important resources. So it was good to really expose how valuable that is. And now we're seeing some additional resources there. In addition, on the research and discovery, right? How valuable we are as UCLA Health as a research university. We were able to be on the forefront of getting testing for COVID-19. We were one of the first in California to be able to do our own COVID-19 test. We did that a year ago in March when the virus was just coming out. And then of course, all the amazing things, not only on the vaccine development, but on treatments for COVID-19 patients. Additionally, you know, some of the other things that we saw is when people were afraid to come in for their healthcare, we were able to rapidly convert to telemedicine. Now, we've always had that technology for many years, but patients didn't want to use it and our physicians didn't want to use it either. Moving to this forced us. We went from doing 100 telemedicine visits a week in our routine to over 10,000. So telemedicine now is here to stay, and we continue to provide that as an option, and it allows us to also free up space for those patients who actually need to come in for care.
Fantastic. Thank you so much for that. So, folks, if you're joining us, I am your UCLA Alumni Association president, D'Artagnan Scorza, and I'm joined tonight by UCLA Health CEO and UCLA Hospital System Associate Vice Chancellor of UCLA Health Sciences, Johnese Spisso. If you want to get in on the conversation, please send an email to Julie Sina at jsina, which is JSINA, at support.ucla.edu. We are taking your questions tonight and would love to have you join this great dialogue. So, Johnese, given what you just said, obviously, having to ramp up testing, having to sort of now focus on vaccination, a lot of folks, inquiring minds want to know, right? They want to know, what does vaccination for the UCLA health community look like, right? Like, first of all, just how much will the UCLA community receive? Can you speak to that at all?
So first of all, vaccine supply chain has been a real challenge, not only in LA County, but in our state, and something that's changing daily. I will tell you that since January, when the vaccines, December and January, they became available, I'm on vaccine meetings 2 and 3 times a day. That's how fast things are changing. Now, the good news I'll say at UCLA Health is we have completed vaccinating our healthcare workers in our hospital and clinic system, in the David Geffen School of Medicine. So that was category 1A. And now what we're doing is category 1B. And as all of you know, this is all the categories, and when we can go to those categories is determined by LA County Public Health. So everything we do is in sync with them. So LA, fortunately, County made category 1B 65 years and older. Some states went to 75. We were glad to be able to begin vaccinating people and our patients that were 65 or older. Now, the problem was we don't have that much vaccine. So when LA County went to that on January 16th, we only had about 10,000 vaccines that we could initially give out. And we have 120,000 attributed patients that are 65 or older. So what we did is, through our population health office, for those 65 and older, we ran an algorithm to look at their record and say, what are their medical risk factors? And then I'm also thrilled to say that we also added a social vulnerability index so that we could really begin to address some of the health disparities that we're seeing. So that formula, health risk plus the social vulnerability index, indicated who got an invite first. So again, every week we've been sending out more invites. The first few weeks, vaccines were slow, and I know we had so many patients waiting. But now, as of today, of the 120,000 patients that we had, 65 and older, we've already invited 110,000 of them.
Wow.
So we're making great progress. We would still like to do more. And we've already told the county and the state, if you can get vaccine to us, at UCLA Health, we've set up hubs throughout our clinics and at our 2 hospital systems. We could do as many as 80,000 vaccines a week. So we want to vaccinate LA. So we're anxious to move to that next category.
Well, the Biden administration announced a deal today, right, where they're receiving 200 million additional doses. I think he said by the end of the year. I know they're trying to manage expectations, but it seems like vaccine production is ramping up. I think they added it's Moderna, Pfizer, and there was one additional.
Now Johnson & Johnson should have an emergency use authorization within the next 2 weeks.
Okay, so it looks like there are more vaccines to come, right? But that doesn't quite answer for a lot of folk. And some of the questions I'm getting from the audience is, well, what about the other strains? I mean, South Africa just kicked out AstraZeneca's vaccine. So what does this mean? Like, is this even going to matter? Like, why should we get vaccinated if the strains might overtake these current solutions?
Yes, I mean, what our infectious disease experts are recommending is still we continue to vaccinate everyone. They do feel that some of these strains will be, the vaccine will be effective on those. So I would really say, we are so fortunate to right now on the market have 2 safe and effective vaccines. the trials, the clinical trials on these, I'll tell you, our team, our experts, our researchers looked at these, and they feel these are two of the best vaccines to hit the market. And when you look at how effective they are, they're right up there with the measles vaccine, right? We haven't, this is one of the most exciting breakthroughs, in science, that this fast we could have vaccines.
Johnese, I want to geek out for a second because I would love to talk about mRNA.
Yeah.
And in fact, I'm really excited about like your social vulnerability index. For those of us who may be out here in the audience that may not be aware of like what these tools are, can you just briefly just explain like what goes into a social vulnerability index? What goes into some of the ways in which you decide or make decisions about measuring
Yes.
who gets the vaccine, right? Because there's been these conversations about like equity. And by the way, folks, stay tuned because we have a special guest tonight who's going to be talking to us about vaccine equity. She's going to be talking to us about COVID and race. But just from your perspective, Johnese, tell us, how do you help make these decisions, right? Let's pull back the curtain for a second.
And we look at, things that are really the social determinants of health. We look at zip code analysis. We look at, poverty level. We also know that as we've looked in Los Angeles and looked at health outcomes of people with COVID-19, we know that it's disproportionately affected the Black and the Latino populations, right? With how their health outcomes not being as good as those who were white who had the virus. So we're really trying to reach out and say, how do we get the most vulnerable people vaccinated first? Now, I will say though, we also have vaccine hesitancy in certain communities. So we are trying to put out education to communities to help people understand the vaccines and want to get vaccinated. Even within our healthcare workers, we've done very well. We've vaccinated about 75% of our healthcare workers, but not everyone wants a vaccine. So we still have a lot to do on education. And, because these vaccines are under emergency use authorization, even in the healthcare setting, we don't mandate our vaccines. We don't mandate, we can't do that it's required, but we are strongly encouraging it. And we're also reaching out and doing public service announcements, working with leaders, particularly in some of the underserved communities, to help be our voice of really educating the community on the safety and the effectiveness of these vaccines.
I was going to ask you about that. Like, what are your strategies? Because I know that you all launched an equity, diversity, and inclusion initiative, right, in the UCLA health system. So how are you partnering with community-based organizations to get the word out there about vaccines? I don't know if you saw this, but Tiffany Haddish had a great conversation with Dr. Anthony Fauci. It was funny, it was informative, but people are really worried about this, right? And there are a number of communities that are not necessarily trusting of these systems. So how are you both partnering with those community-based organizations, but also providing, funding to support that work in the community?
Yes, we've been working and we've been, looking to sponsor not only the public service announcements, but also education and training. We put together just an information module on vaccines. We also have put together vaccine information that we translate into multiple languages. But it really, what we're finding is because there's so much misinformation out there, we really have to over communicate on this so that people understand. Additionally, all of our patients, and we have about 500,000 attributed patients to UCLA Health, we've been writing them a letter each week, specifically with updates about the vaccine and more information. And then we have a whole chat bot on our website that they can ask us questions. And even seeing the questions that we get through that, it helps inform us better of what we need to educate the public on.
Awesome. And I know that there are still some communities that may not have access to, internet. They may use, newspapers. Are you using other strategies to reach them as well?
We are, and we've been partnering with a lot of the foundations in LA to get that information out. We also, the Venice Family Clinic, everyone who works in Venice Family Clinic is UCLA employee. And so through our street medicine program and others, we've been also reaching out to our homeless population.
So Johnese, I'm going to throw one at you. I'm going to read you a brief email, and I want to get your reaction to this because we've been hearing about it in the media, but this one actually came directly to my family from folk who were trying to tell us how we get these vaccines. Listen to this. As you know, right now, only healthcare workers and people over 65 can make appointments for getting the COVID vaccine in California. However, there is a way to get your vaccine. They may tell you they won't have any extra today, ignore them, stand there anyway, right? So here's what you do. Take your ID, go to one of the following vaccine locations, be prepared to wait as late as 4 p.m., tell the staff you're there for a standby COVID vaccination, and I guarantee you that you'll have an opportunity to get your vaccine. So there are emails that are going around in the community, right? Telling us, hey, go dumpster diving for vaccines, right? There was a recent article about the doctor in Houston who didn't want to throw away 10 doses, right? And he's now been charged with violating not only his standards of his employment, but unethical behavior and illegal behavior, right? There's this sort of tension out there between, well, we don't want to waste these vaccines, but yet the people who have access to information, who have their networks, who have relationships, can find a way to get in there and vaccine dumpster dive, so to speak.
Yeah.
How are we prioritizing equity when these are the conditions? If I get an email from a friend of a friend of a friend, and it's a West Side neighborhood that's sharing this information, but my grandmother who got COVID doesn't know anything about it. What can the healthcare system do to address these disparities?
And because we have a lot of different agencies distributing vaccine, their policies are different. So I will tell you how we do it for UCLA Health. And so first of all, I'll say, yes, at the end of the day, nobody wants to waste a vaccine. So get that vaccine into someone. But again, we all have limited vaccines. So what we've worked really hard on in our 5 sites, right, is to every day we have more people that want to get a vaccine appointment than they can. So we kind of overbook as well, so that at the end of the day, we have people that are eligible and waiting, and they're on our on-call list. I will say our staff have done a great job. We have not wasted one vaccine yet because we still have such a queue of patients who need it. What some of these sites and some of the things you're reading about nationally, what happened is some of these sites at the end of the day, they don't have anyone in the eligible population and they're looking for anyone to give it to. The other thing that we have, particularly our sites that are on hospital grounds, is we have a whole hospital full of patients that also need a vaccine. So we have kind of a captive audience there waiting so that we're not wasting vaccine and we can get it to others. The challenge with that is the vials for the vaccine are multi-dose. And once you puncture a vial and you get the doses out, you only have a 6-hour period of time to get that vaccine in someone.
But I think the Johnson & Johnson one, the one that's going to allow you to store it at room temperature?
Yeah.
Fantastic. So, folks, if you're joining us tonight, I am your UCLA Alumni Association president, D'Artagnan Scorza, and I've been graced by having the presence of an amazing healthcare leader here in Los Angeles, Johnese Spisso, who is the CEO of our UCLA Health System and hospital system, and the president of UCLA Health. So I want to thank you, Johnese, for joining us. We still have many questions. Folk are just excited to have you tonight. And by the way, if you want to get your question into tonight's town hall, please email Julie Sina at jsina, JSINA, at support.ucla.edu. Johnese, are you ready?
Yes.
All right, let's do it. When can we open our schools again? When can people go back to schools? That's what folk want to know, right? Like, how are we going to get this done? I know you're not in that field, but hey, people want to know.
Yeah, it's the big question. I will tell you, one of the things that we all want to see is our schools opened again, our economies open. We know the effect this pandemic has had on children and students who've had to get their learning in a non-traditional setting. We also see the effect that the pandemic has had on our local business community. I think we're hopeful that with rapid vaccination, we can begin to start seeing things open up. And the supply chain on vaccines is going to be improving dramatically over the next couple months. So I think there definitely is hope on the horizon.
Fantastic. Thank you so much for that. Really, really appreciate it. Folk, you know, our UCLA Town Hall series is open to all and open to the public, but, you know, I just want to thank the leadership of Team Alumni. We have Christelle, Alex, Lucy, and Jocelyn joining us tonight. I just want to send a huge shout out to you, but there are others who also represent the Alumni Association. So while I'm your president, there's a board of directors that is here that has also joined us tonight. I want to thank Coretta, Todd, and Kathy for their leadership, as well as some of our amazing alums like John Gong and Sally Liu, one of our former board members who are here with us tonight. I want you to know that your UCLA Alumni Association and community is here to support you throughout your journey. And at some future town hall, we're going to talk to you about the Bruin Promise and the way in which we are ensuring that there's value both with your involvement in the association, as well as value that the university is providing to you in your life over time. And this town hall is but one way that we want to demonstrate to you that we are going to maintain connection with our UCLA community and our alums throughout this journey and throughout your life. So, Johnese, you know, I asked you about like diversity, equity, and inclusion, and that's been a significant issue for a number of folk, especially given the murder of George Floyd, right? So we know that our society is having to reckon with the role that race and racism has played. And you, I've read that you're implementing equity, diversity, and inclusion goals within the hospital team. We'd love to hear more about, you know, your goals and your program. Can you talk to us a bit about it?
Yes, thank you. It's such an important part of our work, and this year has really brought forward all the work that we have yet to do. We've moved forward and we've hired our first Chief Health Equity, Diversity, and Inclusion Officer specifically for our hospital and clinic system. And we've rapidly worked on developing a roadmap, an anti-racism roadmap, and also a roadmap to begin closing some of the gaps that we're seeing in health equity and health outcomes in underserved populations. To best prepare for that, over the past year, we've had a series of town halls with our staff called Conversations with Leadership, where we could hear from our underrepresented minority population specifically about things that they were witnessing and ways that they felt we should improve. We really wanted to design this program in partnership with our employees, and we're still learning and listening every day. But we have had just an amazing response from our team members coming forward and really pointing out the things that we needed to change in the organization to really create an environment where not only everyone is included, but everyone is welcomed. And then again, looking at how we translate that into our service for patients and into the work that we do for the community. So I'm so grateful and appreciative for our staff for coming forward with those ideas.
Thank you so much for sharing. Really appreciate your leadership in that area. Now, folk, if you don't know, Johnese Spisso, Nurse Spisso, in 2019 was listed as one of the top 25 most influential women leaders by Modern Healthcare. In 2020, she was also named in both LA Business Journal's 500 most influential leaders in LA and Modern Healthcare's top 50 clinical leaders in the US. So, you know, your leadership, Nurse Spisso, has been critical to advancing health, obviously not only here in Los Angeles, but around the country. And, you know, folks want to know, like, what drives you to help close that leadership gap, and what inspiration can you pass on to other women who strive to achieve that level of leadership or may have similar goals?
Oh, thank you so much. Well, and I'll say, you know, those awards are really the reflection of the work our entire team does. I just happen to be the person who is, you know, has the great opportunity to be the leader of this team. But I will say, you know, throughout my career, I've had so many strong mentors, so many women in leadership. So I've always worked at institutions like UCLA, like UW-Medicine, where women in leadership were supported. And so I never felt that that was limiting to me. And I've always, in my roles, I've really tried to work to serve, to mentor people who want to develop further in leadership and really give back on those opportunities. And I'm just so thrilled and fortunate to be at such an institution like UCLA Health that really provides us so many resources so that we can effectively provide mentorship and learn from each other.
Fantastic. Thank you for that. I think one of the questions that folk have is, yes, absolutely. And it's great to hear that UCLA is a welcoming environment for the leadership of women. But we know that we live in a society sometimes where that's not always the case. So as a woman and a nurse, do you ever have challenges with male doctors taking direction from you?
I think we've all had, different challenges at times in our career. We all work with a lot of strong personalities. But I will say, I think now organizations have done so much training on professionalism, on accepted behaviors, that what I really like seeing now, and when I think about how it differs from the career that I started 30 years ago, I think we've done so much in training, particularly in healthcare, on everyone on the team having a voice and everyone on the team having a role. So it isn't that same type of fear to speak up as it was 30 years ago.
So I noticed you didn't answer the question with a no. But I appreciate the way you did answer it. So thank you for that. So I imagine there are always some pockets where there's still work to be done, still opportunities for us to improve. And I want to just thank you for your mentorship, which is one of our Alumni Association words here. And also thank you for ensuring that, my wife is a huge proponent of UCLA Health, and knowing that there are women in leadership, I think helps to ensure that the many mothers, the daughters, the sisters, right, the aunts, the grandmothers that we have, their needs are also being represented and taken care of in our healthcare system. So again, thank you so much for that. Folks, stay tuned because we have a special guest who's going to be joining us here in about 5 minutes or so. I know you're going to enjoy that conversation. Again, I want to thank you all for tuning in tonight. I am your UCLA Alumni Association President, D'Artagnan Scorza, joined by Johnese Spisso. And so if you have a question, go ahead and send your question over to Julie Sina at jsina, which is JSINA, at support.ucla.edu. Now, the pandemic has cost the UC system billions of dollars. And the health system, I'm sure, has also faced challenges, right? As you've had to shift from elective surgeries and other methods of sort of maintaining your revenue. Nurse, can you talk to us about how have you been able to weather the storm? First of all, how has the pandemic impacted the hospital? Let's just start there.
Yes. So in the first phase of the pandemic, you'll recall that I said it layered on a really full hospital system. Well, one of the things we had to do, we had public health orders to say we had to stop doing any non-emergent or non-urgent surgeries. We had to really ramp down. And so all of the hospitals in LA, we immediately started canceling anything that could be canceled. That had a dramatic impact on revenue in the first few months. We had lost over 260 million in revenue, and we still needed all of our staff. So I am really proud to say that we've weathered this whole pandemic without laying off one employee in the health system, which was amazing work. And because we knew we were going to need all of our staff when we were back to full capacity. Now, there was some federal funding, some of the CARES Act money that helped see us through. And then while we still had a lot of gaps to make up, we quickly started opening back up to patients from every type of normal disease process that we see once we had some of the health order lifted. We operated like that for the past several months. And then again, in December, when we saw a surge again, we again had to start ratcheting back some of our routine surgeries and things. And so that also definitely in December and January, we had another financial hit. But hopefully we're through the most surge now and we can get back to business. And there's been a lot of patients that are waiting to resume some of their care, and we're working really hard to get them all back in.
Thank you so much for that. Do you anticipate this sort of package in Congress having an effect upon the hospital system? And what are your thoughts about what our federal government and representatives may be doing to help shore up even our local hospitals in their
yes.
health?
And our lobbying agencies, not only the work that we do through UC, but through the American Hospital Association, the American Association of Medical Colleges, we are all really supporting some of the efforts that we need. Coming out of the pandemic, we've all learned a lot about additional things that we need. We all know that we need some additional funding and research as well. So we continue to put together our legislative agendas around those priorities.
Fantastic. Thank you so much for that. So where do you think the hospital is going to land after all of this? Do you think we're going to be financially solvent? Do you think we're going to suffer and struggle along? And is that going to impact the quality of care?
So I'll say, again, and I'm thrilled that we were able to get back to full business so soon, and that's thanks to the tremendous dedication of our staff. We will come out of this financially solvent, and we don't expect to be cutting our resources. The community depends on us for service. And again, really am pleased overall with how we've weathered this.
Fantastic. Well, I want to thank you so much for answering these questions, folks. I told you we're going to have a special guest tonight. So at this time, I'd like to go ahead and welcome in our very special guest. And nurse, you're not leaving us yet, so don't wait by. Don't wait by. Yeah. We're coming back to you. Thank you so much. So tonight we are joined by the amazing Dr. Omai Garner, who is an associate clinical professor and director of clinical microbiology in the UCLA Health System. Dr. Garner received his Ph.D. from UC San Diego. He's a Triton folk in biomedical sciences. He was a postdoctoral clinical microbiology CPEP fellow in the Department of Pathology at UCLA and a former McNair Scholar. We are both McNair Scholars, so go, Dr. Garner. He is board certified by the American Board of Medical Microbiology. And his research focuses on novel point-of-care devices for infectious disease diagnosis in the developing world. He also serves as the chairman and co-founder of the Social Justice Learning Institute, which is a nonprofit organization committed to closing disparities in health and education here in Los Angeles County. Dr. Garner, welcome to tonight's town hall.
Thank you, Dr. Scorza, President Spisso. It's wonderful to see you as always. Hello, UCLA Alumni Group. It's good to be able to talk to you again.
Thank you so much. Can I just throw in, he's like one of the most amazing people at UCLA Health. And the reason in Los Angeles that we were able to bring COVID testing into Los Angeles last year in March, it's all him.
So there you go. Oh, Doctor, look at that. How amazing. She didn't even know you were joining, by the way. I didn't pay her to say it. I'm just letting you know.
As President Spisso says, it's a team effort. I got 120 people in my lab working around the clock, and I just have to thank them all for their effort.
Fantastic. Well, I tell you what, future healthcare leader there yourself, soon to be President Garner. No, he's not coming for your job yet. I'm just saying.
Long career in front of me. Long career.
Long career. Well, Dr. Garner, thank you so much for joining us tonight. It's such a pleasure to have you here. And one of the reasons why I wanted to have you here in this conversation is to talk about race, right? Nurse Spisso and I, President Spisso and I talked quite a bit about sort of the work that the healthcare system is doing. But given your work in the nonprofit sector and given your work sort of in community, can you also talk to us about sort of how, what can we do to help address issues related to COVID and race? We know that there are major disparities associated with sort of COVID and communities of color. So talk to us a bit about, how you envision not only our healthcare systems, but our local institutions responding to these disparities at this time.
Yeah, absolutely. Dr. Scorza, I want to thank you for the question. So, I think that it's just plain facts that minority communities are unequally impacted by this pandemic. And that has to do with longstanding institutional racism, structural racism, and healthcare inequities. The pandemic has just brought that out even more. So if you look at death, if you look at overall disease, Black and Brown communities are at the highest risk from COVID-19. What's also become clear, and this is unfortunate in this pandemic, is that people aren't affected at the same rates, are not infected at the same rates. And overall, this is because people either are living in shared housing situations, are more often likely to be essential workers and can't isolate from home. So when we look at an entire structure of the pandemic, I think that we realize we need to find a way out of this as soon as possible. The economic impact, the personal impact, look, 400,000 people have died already. But public health measures in and of themselves have not been successful. Lots of different reasons that has occurred. And one of my main concerns right now, because as President Spisso pointed out, we actually have an effective vaccine. It's amazing. We have a vaccine that was so much more effective than we even thought it was going to be. We have 2 effective vaccines. And yet when you look at surveys in minority communities, so recent surveys in African-American communities have suggested that even when the vaccine becomes available, less than 15% of the people are going to actually take that vaccine. And so to me, this is something that I've made a personal mission over the next 2 or 3 months, which is to educate communities as much as possible. And this is what I think healthcare providers should do across the board. UCLA Health has been leading in this. Educate communities as much as possible about why the vaccine is safe, why the vaccine is effective, and why the vaccine is something that's so important to be able to get out of this. So I've been doing lots and lots of vaccine education talks, community-based, school-based. I've talked to youth, just getting the information out there, because as President Spisso pointed out, look, there's a lot of misinformation. And then we also have to look a little bit at the justified mistrust of minority communities with our healthcare institutions in the United States. Look, I recognize this is a large hill to climb, but we have to climb it if we're going to get out of this pandemic.
Fantastic. Thank you so much for sharing, Dr. Gardner. So given what President Spisso has just said, she said, you're the reason we have, we've been able to ramp up vaccinations in Los Angeles. Tell us, so how did you all do it? Tell us what you've done and how you were able to help get, COVID testing ramped up here in LA so quickly.
Sure. So for the clinical work I do at UCLA, I run our infectious disease diagnostic laboratory. And early on in the pandemic, talking January or February, we started to realize that this was going to be a problem. Not only kind of a minor problem, but potentially a very large problem. So with the support of our hospital system, with the financial support of our hospital system, we actually started doing research into testing right away. And so as soon as testing became available, we were ready to go. And we launched one of the first COVID-19 PCR tests in the Southern California area. And then we've just been ramping up ever since, because testing was one of the early ways that we were actually able to understand and then also control the pandemic. I don't mean control the widespread, but I mean within our healthcare system, to make our healthcare system safe for our patients to come back to. Because if you remember early in the pandemic, people stopped going to the doctor. People stopped going to the hospital because they were justifiably afraid of disease, of COVID-19 in that area. So testing has really allowed us to get back to providing the service we were providing at UCLA Health. But we're not going to test our way out of this problem. Testing shows up in the news all the time, and is there at-home tests? And testing is a piece of the puzzle, but we really have to look at this from all angles. And now it's really an approach to vaccination that I think is the next challenge.
Fantastic. So, Dr. Garner, you just had a child. You just had a son, right? Congratulations.
Yes, thank you. Thank you.
How has it been sort of raising, a newborn baby through all of this?
It's fascinating, right? So we call him a coronial, right? Because he was born the year of 2020, the year of coronavirus. And, for all of you that have children out there, it's a beautiful experience. It's hard to put into words the experience I've had over this year becoming a father, but it's been interesting in its dynamic because we were fortunate enough to be able to keep our son at home during this entire time. But that's not true for everybody, right? And some people have had to have their children in daycare. They've had to have children out of school. And so their children have been at risk. They've been in situations where they potentially caught COVID-19. So as a new father, I think about that a lot. I think about the suffering of parents. I think about the fear parents have of their children getting infected, maybe bringing a virus home. You had mentioned the question about schools and all the controversy around that. I think being a father this year has just given me a new outlook on the pandemic and on, my own family, my own growing family's safety and how we can best work through this because, there's light at the end of the tunnel. My son hasn't met people. My son has only met his grandparents once, right? They live in Wisconsin. They were fortunate enough to come out in January, and then they've had to stay away for an entire year. They're FaceTime grandparents, but he wants to be real face-to-face grandparents. Look, the faster we can get vaccination out, the faster I can connect him to that generation. So, like I said, I'm looking forward to great improvements that are to come, and he's just been my motivating force behind that.
That's amazing. That's amazing. I want to thank you, Dr. Garner, for joining us tonight, just sharing with us both your perspective as well as lifting up some of the strategies that we can employ to help reach hard impacted, in some cases hard to reach communities. President Spisso, I want to thank you so much as well. Tell us, from your perspective, I mean, how has it been with you and your family this year? How are you holding up personally through all of this?
Well, I think as I mentioned earlier, so first of all, I was grateful to be in healthcare because I did get to come into work and I did get to interact with all of my great colleagues. And I think as our team, we inspired them. But it definitely has been difficult to not be able to do family events, that type of thing. I'm fortunate that I have a daughter and she lives in Santa Monica, so I did get to see her. But my husband actually is a physician and he works in Seattle, so I have not seen him very much.
Wow. Well, I have to tell you, we are so grateful to have your leadership. Now, when we look back on this at the end of this pandemic, they're going to say, look, there's some lessons that we've all learned. So can you just share with us, just briefly, what are some of the lessons that you think we're going to take away with us into the future of healthcare, into the future of our health systems moving forward? What are some of the lessons that you've learned over the course of this pandemic?
Well, I'll start briefly and then turn it over to my colleague. I'll say, definitely being in an academic health system, I think this was an opportunity on a national and international platform to have the public see the benefits of these research universities. The ability to study the patient care population, to have amazing people like Dr. Garner and other who are providing clinical care and research and education together come up with, the testing, the pathway to vaccines. I think it's really definitely shined a light on the value of that, as well as the value of investments in research and in public health.
Fantastic. Dr. Garner, would you like to share some of the lessons that have been learned during this pandemic?
Sure. It really stands out to me that we are economically one of the richest countries in the world, and yet we have some of the most death and some of the most infection associated with this virus. So, working in virology, working in an infectious disease, it's just very clear that this is going to happen again. So to me, this is all about pandemic readiness. How do we better as a society get ready for COVID-30 or whatever the next thing that's going to come along, and handle it just so much better so that there's much less suffering than what happened this time. So, I won't say that as a country we're super good at learning from our past. That said, I remain hopeful, and I'm hoping that we can build the infrastructure, as President Spisso pointed out, fund our public health entities, build the infrastructure, address disparities in healthcare now, so that at the next pandemic, you don't see them stretched out the way that they're being stretched out. Address racism, address all of these issues so that all of that makes us better prepared. So I'm hopeful and I'm looking forward to being part of that process.
Fantastic. So the final question for you both, and I think this one is probably one that we all get to reflect upon and ask ourselves. How has COVID changed you personally, and how do you think it's changed all of us? I'll ask you, Dr. Garner, to go first, and then President Spisso, I'm going to give you the final word.
Sure. So, I'm in my early 40s, and your early 40s is an interesting time in your life because when you're in your 20s, you feel pretty invincible, right? You're like something bad happening you don't recognize it. And then I think once I've moved into my 40s, I'm a parent, I start to not sort of tackle or grasp with my own mortality, but at least consider it as an option. And so I think in that setting, it has just made COVID-19, and again, this is sort of silver lining stuff and how it's changed me. It's really made me appreciate life. Look, I call my father every day. My father's 81 years old, and I was not doing that before. And I love that I'm doing that now. A lot of it's to FaceTime with his grandson, but you know what I mean? I get to see and interact with him, and that's a special interaction. And so, with all of the suffering in this pandemic, it's really made me connect. And it's interesting because now it's by Zoom or remote, connect with my loved ones, connect with my family and friends, and really appreciate the time that you have, because some things are definitely out of your control.
Fantastic. President Spisso.
And I couldn't agree more. I think, just the appreciation and value of, those personal interactions, the fact that we can't take anything for granted. And I think, the uncertainty that we had throughout phases of this pandemic, it's certainly made me really recognize and appreciate that, we need to just really focus on making every day an important day and connecting with family, friends, and loved ones. We've seen so much, devastation of people who lost loved ones to this pandemic. And what a horrific time when families couldn't even be with their loved ones, Zoom funerals. I mean, it's been on every level, it's really wreaked havoc and really has devastated families. And so, it's made me really appreciate the times that we have.
Fantastic. Well, I just want to thank you both for joining us tonight. If you are out there and you're listening, I want to thank President Johnese Spisso, who is over UCLA Health, also serves as a CEO of UCLA Hospital System and Associate Vice Chancellor of UCLA Health Sciences, as well as Dr. Omai Garner for joining us tonight. Our next town hall is March 18th, and we'll be joined by Dean of UCLA Undergraduate Education, Adriana Galvin, who's going to talk to us about remote learning life for our students and faculty. And we'll also share with us what the future of learning will look like for our UCLA community. Again, thank you for joining our UCLA Alumni Association Town Hall series. I want you all to leave tonight on a really happy note. Give me 1 second, because we've been talking about COVID, but I want you to see beautiful puppies tonight, okay, everyone? Beautiful puppies. Say bye to Ruby, all right? Say bye, Ruby. Say bye to everybody. Thank you all so much.
Thank you.
Have a wonderful night, and go Bruins.